Hi, we are Group 4 and we will be providing range of motion today and positions used in physical assessments. These are our two nurses, Kara and Megan, and this is our family member of our lovely patient, Carmen, and our family member is Tia. Our nurses, Kara and Megan, have performed hand hygiene and have donned their gloves and are now about to perform range of motion on our patient, Carmen. They will begin at her head and work their way down.
What are you doing?
I'm going to perform passive range of motion on your family member.
But she doesn't need that.
Actually, she does. Passive range of motion prevents her muscles from tensing up and losing their elasticity, also called a contracture.
But she's not getting up anytime soon.
Exactly, that's why she needs it.
Okay, well, how do you know when you've gone too far? What if you break her neck?
We stop when we feel any kind of resistance or see that the patient is in pain.
Okay.
Nurse Megan is now starting at our patient's head, chin tilt down, flexion and extension. Now Nurse Kara will be moving from left midline to right midline. They are now moving down to our patient's shoulder. They will support her shoulder and her wrist as they abduct outwards and adduct inwards. And they will now move on down to her elbow, supporting at her elbow joint and supporting at her wrist. They are now moving to her wrist. They will support her wrist and they will flex and extend. They will also then perform supination and pronation. They will now flex her fingers toward her palm in a rolling motion. And flex and extend her thumb. They will also roll each of her fingers. Now our nurses are moving down to our patient's hip. Nurse Megan will support our patient at her hip joint and her ankle, flexing and extending her leg. Now our nurse Kara will be abducting and adducting her leg, supporting at her hip and her ankle as well. They will now move down to our patient's knee, supporting the knee and holding at the ankle. They will bend and extend, returning to her original position. Our nurses are now moving down to the ankle, bending at the foot toward the body, which is dorsiflexion, and bending the foot downward, which is plantar flexion. They are now going to do her toes, curling the toes downward and straightening her toes. And that is passive range of motion. They are now going to cover our patient back up to make sure she stays warm. Now that our range of motion is complete on our patient, our nurses have removed their gloves and performed their hand hygiene as normal. If the bed has bed rails, obviously they would make sure that they were up, but we don't have any, so that is not an issue.
I heard some popping. Is that normal?
That is normal. We document every pop of a joint that we hear just in case something comes up later.
Okay, and so, I understand, you guys are busy, so, that looked like pretty simple fluid motions, to keep her, loose and everything. Can I do that with her also?
Oh yeah, totally. We can teach you how to do it so that you can provide for her when we're not around or we're busy.
Okay.
Should I do it over?
Should we cut?
I don't know where I'm at.
Our nurses, cut. Now our nurses will move down to our patient's hip. They will support her hip joint and hold at her ankle. They're going to flex her leg upward and extend to return to the bed surface.